Good morning, guys. Welcome to Pioneer Advanced Hair Transplant Center. Usually transplantation procedures we are doing, basically there is a lower age limit, there is an upper age limit. Most of my patients were asking me, what is the upper age limit for going for a transplant surgery? So we all know that basically age less than 25, we don't recommend transplantation. Well, when it comes to the upper age limit, is there any age limit for the transplantation procedure? Well, when it comes to upper age limit, what is the upper age limit that we can think about going for a transplantation procedure? That's the most of the people have in their mind. So kindly watch this video until end to understand what are the age criteria to choose a patient for a transplant surgery, and if at all if you go to choose, what is the upper age limit, and what are the precautions, conditions, how are you going to evaluate for the before surgery. In this video, I'm going to discuss about it in detail. Kindly watch this video until end. Actually speaking, there is no strict upper age limit for undergoing a transplant surgery, considering their overall general health conditions supposed to be very fair, and they should not have any underlying medical health issues. That could be many, like hypertension, blood pressure, many other systemic diseases we have to evaluate before getting into any surgery, not only because of transplant, any surgery. That pre-evaluation we have to do. Otherwise, if the medical conditions are really fair enough, at any age we can do transplantation. Well, when it comes to not only health, what are the other parameters patient has in their mind to consider transplant or not? Because my age is around 55, can I go with a transplant? Next question they would ask is, like, my hairs are gray, can I go with transplantation? So, well, underlying medical conditions are fair enough, we can go with a transplant. If you have gray hair, no problem. Gray hair can actually gives you nice camouflage in some patients. Definitely you can go with transplantation procedure. Some patient would ask me, can you harvest only black hair and implant it? That's not practically possible when someone has a gray hair more than 30-40%. And the lifespan of the gray hair as good as a black hair, it doesn't change because of the color. So another point is, provided hair loss pattern type, usually in adults above 40 years, what happens is a further hair fall definitely would be diminished or stabilized. That's a very good candidate for getting for the transplantation, because further hair fall will not be happening in that patients. That means whatever you're going to implant, it will last for longer. So this is the other criteria. Next criteria would be, what is the condition of the donor availability? Imagine either it could be 40 years, 60 years, 70 years, doesn't matter as long as they're healthy. What about the donor status? Donor, do they have enough donor in the backside, or do they have a beard grafts? In combination, can we do the procedure or not? All this really matters, provided good donor if they have it, irrespective of the other things other than medical conditions, can happily go with a transplantation. And most of the people ask me, because I am 55, 60 years, how is my healing process? If you are not having any medical elements and your healing is not delayed by because of any systemic conditions, I'm sure a transplant is not a problem to get it done. And growth rate, how is going to be after a transplantation, everything as good as youngsters. I've seen most of middle-aged people get best results because they have stabilized pattern hair loss. Whatever we are going to implant, it will last for longer, more than 15-20 years. That makes them and gives them second life. So provided all these conditions are matching, I'm sure transplantation is possible with any upper age limit. Middle-aged patients always have realistic expectations. I'm sure hair transplantation results always match to realistic expectation. That is the another added advantage for them. Very important point. It's very much essential to see a best specialist, a surgeon, to evaluate your hair transplant case, because evaluating will change to person. On a general note, most of the patients bring their sons for a transplantation procedure. Later on, they underwent their procedure with me. A reason is, initially, middle-aged people actually they would not show that much interest towards the transplantation procedure, but Once they get confidence by looking different patients, and they would definitely give you a try. Well, what happens in consultation is they'll not be that serious, but they just have information and they'll come and take information. Once they get the information, once they're sure that they would get hair, most of the Middle East people, around 45 above patients, took transplant with me. And they believe me, the feedback I got it, not many doctors from the UK and the US preferably, I did it. And they honestly accepted the fact that after doing 1 or 2 sessions, their general health has been improved because their confidence levels are improved to a great extent. Imagine they were always denying themselves, they always socially isolated because I don't have hair. Then later on, after doing 1 or 2 sessions, their feedback was excellent because they said in their own words, I'm just hitting back my gym, I'm moving, socializing much because of my hair now. That made me more confident and kind of a second life. This is the feedback I got from most of the doctors and some guys, software engineers who underwent transplant in the Middle East. Recently, I had a patient, 67 years, a sports bike driver. I'm so happy to see him with good results later on. That's really boosts the confidence. That's the idea of getting done transplantation in the Middle East or more age. So, if provided underlying medical conditions are there, like hypertension, diabetes, well, if it is under control, fair control, definitely you can take consent from a corresponding doctor and still you can get it done or transplantation. There are few medical conditions where we cannot do transplantation very rarely. Otherwise, any fair health condition, people definitely can go with a transplantation, provided you have to have the decent donor and you have to choose a best surgeon. So that's the story about upper limit of the age limit for the hair transplantation procedure. Well, choose the best doctor and take your details because each patient perceptions, each patient assessment is totally different. Your surgeon can explain you whether you are a suitable candidate for transplantation or not. Thank you.